So we've looked at a lot of factors that will guide us in prioritization. I'm still going to give you some more points that will guide you when you are presented with a lot of other case scenarios. Freshly post-op have stressed that over and over again. Client has just arrived on the nursing unit for post-anesthesia care. From post-anesthesia care, we have to prioritize the client. Client whose status has deteriorated from the baseline. So the vital signs are deteriorating, the level of consciousness, and then the neurovascular status. Client exhibiting signs of shock, including hypovolemia, hemorrhagic shock, cardiogenic, distributive shock. Clients who have had an acute onset of an allergic reaction. Some can even come with respiratory distress. Clients with chest pain. Client who has just returned from a diagnostic procedure and may require some more intensive monitoring so that we can assess for any complications that may have come up from the procedure. And then a client telling you unexpected or unusual symptoms, which may be new or suddenly increased acute pain. So the client came with symptoms, all right, but now is complaining of some other symptoms, including blurred vision, sudden weakness, or paralysis. So let's say a client is on the ward and the client is has a diagnosis of depression. And you go see the client says, I don't feel like talking to anybody. I have low mood. I cannot sleep so well. I cannot eat well. All of that is part of the package for depression. But when you see this client and now this client has started complaining of blurred vision, now is having some sudden weakness or paralysis. That is an unexpected finding. We are not expecting to see that in a client with depression. So you will prioritize the client at that point. A client who has had an equipment or tubing malfunction or accident, such as disconnection of an IV line, a central line, chest tube, or the alarms ringing on the mechanical ventilator or cardiac monitor, you've got to prioritize. And note, lower priority clients could be clients who are stable, they need some teaching, even maybe prior to discharge. That client will not be our highest priority. So I hope these indicators have been helpful. This is another important part of prioritization that you should know. In an unwitnessed accident, the black tag, clients who are already gone, it's likely that we're going to lose that client. So at the scene of an unwitnessed accident, although we spoke about pulselessness and breathlessness as high priority, but if it's an unwitnessed accident and you get to the scene, those clients who are pulseless, breathless, and clients who have fixed dilated pupil, that client is already almost dead. That client is gone. So you're going to reserve your energy and help save those who are likely to live. So if you see these key phrases in a question, then that client will be our lowest priority in an unwitnessed accident. These phrases will point to lowest priority client. So do not get confused. This is an important point that you must take note of. When you see unwitnessed accident, take note.